Some people find that their blood pressure is normal at home but rises slightly when they are at the doctor. This is known as white coat syndrome or the white coat effect. The syndrome gets its name from doctors and medical staff who sometimes wear white coats in a professional setting. A healthy blood pressure reading is around 120/80. Anything above this is considered high blood pressure. White coat syndrome may make your blood pressure read higher than it normally is, and the effect isn't always a minor issue of doctor-associated anxiety. For some people, white coat syndrome could be a sign of a more serious blood pressure condition. White coat hypertension is high blood pressure that occurs at your doctor's office or in a medical setting, but not in other settings. Regular hypertension is high blood pressure that occurs in many scenarios, not just a medical one. Among those with high blood pressure at the doctor's office, 15 to 30% of them may actually have white coat hypertension. Experiencing the white coat effect doesn't mean you have more general hypertension. Likewise, some people with hypertension don't always experience high blood pressure at the doctor's office. Some doctors believe white coat hypertension could be a forerunner of real hypertension. In fact, one study found that people with white coat hypertension had an increased risk of stroke, heart attack, heart failure, other cardiovascular conditions. Another study found that death from heart disease was strongly associated with white coat hypertension. For these reasons, reaching a diagnosis and deciding if you need treatment for your elevated blood pressure is important. A doctor in a white coat isn't the only cause for occasional hypertension. Some people experience moments of increased blood pressure because of other stressors like work, an emergency, or not taking your blood pressure medicine for several days, eating food that's high in sodium, or consuming a lot of caffeine might also temporarily increase your blood pressure. While your blood pressure might return to normal once the trigger is removed, the increase in blood pressure can still be cause for concern. The temporary increase in blood pressure, whether it's from a doctor or another cause, can cause strain and damage to your heart. If this temporary increase in blood pressure occurs for a long period of time, the damage can become more severe. Knowing that your blood pressure might climb higher in your doctor's office may actually become a self-fulfilling prophecy for some. In other words, the worry that you will have a high blood pressure reading may actually cause just enough anxiety to boost your blood pressure. If you are feeling anxious or worried when you sit down to have your blood pressure measured, ask the doctor or nurse to wait a bit so you can calm down. Sometimes the triage areas of doctors' offices are crowded with people and office staff. Ask if you can move to a quiet area away from everyone else so you can get a more accurate measurement. Find a technique that helps you calm down when you're anxious or stressed. For example, breathe deeply and inhale slowly. Talking while having your blood pressure taken can help distract you from the test and improve your reading. For others, however, sitting quiet without talking may be more relaxing. Try different methods to see which works for you. If you have a high blood pressure reading, your doctor may ask you to come back to check your blood pressure again over the course of a few weeks or months. Most doctors won't make a high blood pressure diagnosis off one high reading. Prescribing a medication for hypertension off one elevated blood pressure reading may lead to serious issues, including hypotension. Hypotension occurs when your blood pressure drops too low. You may feel weak, dizzy, or even pass out from low blood pressure. Instead of making a diagnosis, your doctor may ask you to return again several times over the next few weeks to monitor your numbers. Of course, this can make the white coat effect appear again. That's when you should talk with your doctor about other blood pressure monitoring options. A visit to the doctor's office may cause a temporary increase in your blood pressure. It's not always a sign of a bigger problem, but it's worth monitoring. If you're worried about your blood pressure numbers, talk with your doctor. Together, the two of you can find a diagnosis and decide on the best way to treat it. If you enjoyed this video, subscribe, like, share, and comment.